Welcome to the Delray Beach Surgery Center. Located at 4800 Linton Avenue in Delray Beach, Florida, this is where your carpal tunnel procedure will be performed. Because your procedure requires IV sedation along with local anesthesia, you will need someone to drive you both to and from the surgery center. On the day of your procedure, you will be asked to arrive 1 hour before your scheduled surgery time. Be sure to wear comfortable clothing and remember to leave all jewelry at home. At the time of registration, you will need one legal photo ID and your insurance card. All copays and deductibles will be made at this time. Additional paperwork will be completed so that the center can file with the proper insurance carrier. After the paperwork has been completed, a name band will be placed on your wrist for identification purposes. After the registration process, you will be asked to wait for the nursing staff to call you in for your procedure. The nurse will take you to the pre-op area where you will be asked to complete the clinical paperwork such as the informed consent. Consent was discussed when you first booked the surgery. Signing this form acknowledges that this has been discussed with you and that you agree to have the procedure performed. In preparation for your surgery, you will change into a hospital gown behind a curtain. Once changed, you will be provided blankets to keep you warm and comfortable. The nurse will then mark your hand to visually identify the correct extremity or digit where the procedure is to be performed. An IV will be started and EKG leads will be placed to monitor you throughout the procedure. Preoperative antibiotics will be administered to minimize the risk of infection. You will meet the anesthesiologist who will review your medical history and allergies. They will be happy to address any questions or concerns that you may have. Before the procedure begins, Dr. Luskin will visit with you and answer any last-minute questions you may have. After completing the preoperative process, you will be transferred to the operating room for your procedure. It will take about 10 minutes to get you in, positioned, and draped. A blood pressure cuff is used to create a bloodless field for the surgeon. The actual carpal tunnel surgery takes only about 10 minutes to complete. It's a routine procedure that Dr. Luskin has performed several thousand times over the past 15 years. The anesthesiologist will be at your side throughout the operation, maintaining your sedation and monitoring your vital signs. After completing the surgery, Dr. Luskin will apply a bandage with gauze pads and tape, leaving your fingers free to move and use. You will then be transferred to the recovery room where you will wake up from the sedation. This only takes a few minutes, and your vital signs will be monitored until you are sufficiently awake. In the recovery area, Dr. Luskin will let you know how your surgery went. Although you may seem awake, many patients have trouble recalling this conversation given the effects of the sedation. Once adequately recovered, you will get dressed and prepare to leave the surgery center. Your family member or companion will be asked to drive up to the building and you will be assisted into your vehicle to go home. The complete procedure only lasts approximately 2 hours. Your family member can either wait at the center or come back when you are ready to leave.